Hi students, welcome to the next video in odontogenic tumors. In this video, we are going to discuss about odontomas. So this is a very small topic, odontoma, and odontomas are odontogenic tumors which are arising from your both or ectomesenchyme and your epithelium. Right? It's a mixture of your odontogenic ectomesenchyme and your odontogenic epithelium. Right? So odontomas are the most common odontogenic tumor. So ameloblastoma comes second. Odontomas are considered as the most common odontogenic tumors, and it is a tumor of both your ectomesenchyme and your odontogenic epithelium. So far we were discussing about tumors of your odontogenic epithelium, right? Your ameloblastoma, your AOT, okay, your CEOT, etc. Those are all tumors arising only from your odontogenic your epithelium, right? Odontomas are tumor which arise from both your epithelium and your odontogenic ectomesenchyme. So you know that to form hard tissue, what is the function of this ameloblast and what is the function of this odontogenic apparatus? To make enamel and dentin, right? So it requires both. No, only the epithelium or only the mesenchyme cannot make hard tissues. To make enamel, to make hard tissues, you need both, right? You need both. So there is a cross signaling between mesenchyme and the epithelium to make the tissue, hard tissue. So odontoma is a tumor of your both your mesenchyme and your epithelium, odontogenic epithelium, so that there is formation of hard tissue. What hard tissue? Enamel, dentin, cementum, etc. So this is the most common odontogenic tumor. Comes first. Second comes your ameloblastoma. And what is other facts regarding odontoma is that I have told you when we were talking about AOT, odontoma is also considered as a hamartoma. Okay, it is also considered as a hamartoma. Means it's a growth of a tissue, a small growth of a tissue which is native to that area, right? Okay, now odontomas are usually coming in young individuals, okay, in young age, usually less than 14 years, 14 to 15 years. Okay, that's the most common mean age of occurrence of this odontoma. And odontoma is also of two types. Okay, that is one thing. Odontomas are all of two types. So I'm writing here odontoma. Odontoma is of two types. One is called compound odontoma, and other one is called complex odontoma. Now you may have seen the term using composite in some textbooks. Composite odontomas. Composite just means that it is a mixture of enamel, dentin, cementum pulp. Okay, that's all. Composite just means that it is a composite. It means it's a mixture. It's a mixture of enamel, dentin, symptoms, and sometimes you can see pulp tissue also. Not sometimes, usually you can see pulp tissue also. So compound and complex odontome is the term. Compound odontome and your complex odontome. In certain textbook they say compound composite odontome, complex composite odontome. That word composite is just meaning that it is a mixture of all. Okay, so we don't want to use this that term. We will use compound odontome and complex odontome. Now what is the feature of this compound and complex odontome? How can we differentiate? If the odontoma formed will look like a tooth, okay, if it is looking like a tooth, a perfect structured tooth, means it has enamel, it has dentin, and it has pulp, but the architecture will look like a tooth. Okay, look like a tooth means it will have a deposition of enamel. Okay, it will have a deposition of enamel like this. Okay, it has enamel deposition. Then comes a part of dentin deposition. It will deposit some dentin here. Okay, and in the center it has some pulpal tissue. So this tooth will look like this. This structure will look like a tooth. It have an appearance of a tooth. Okay, it has appearance of a tooth. It has structural arrangement. Enamel comes first, then below that little dentin, then inside sometimes a pulpal tissue, and in the side they may have a little of cementum. Okay, so it is looking like a tooth. But in complex odontome, what happens? This enamel, the dentin, okay, somewhere there is dentin, somewhere there is enamel, okay, and it is all disposed in a mass. It is just a mass of tissue. So we call it as conglomerate mass. Conglomerate mass means it is just a ball. It is just a ball of worm. Okay, it is just a mass of tissue which has enamel somewhere, dentin somewhere, pulp somewhere. Okay, so it is just a mass of tissue, a hard tissue mass. That is complex odontome. According to structure, according to its resemblance. So we are using resemblance here. Resemblance, how it is resembling a tooth. Okay, compound odontomas usually come in the anterior region. Complex odontomas usually comes in the posterior region. See, This is just based on some incidents. Okay, it doesn't matter that compound and complex odontomas can anywhere, it can come anywhere, it doesn't matter. Okay, location doesn't matter, it can come anywhere, but most commonly compound odontomas comes in the anterior regions, while complex odontomas comes in the posterior regions. Okay, this is just based on some incidents. Okay, it is not always true. One thing is there, one thing extra you can see in the histology of odontoma is that you can see ghost cells. Now, I hope you remember that moment we discussed about ghost cells, and we have listed out many lesions which show ghost cells. If you are remembering, give your brain an exercise right now. Just memorize the lesions which show ghost cells. Okay, so if you are capable of recollecting that lesions, then your preparation is going in the right track. Okay, so this is how you have to learn. You have to give revisions. Revisions is the key. Okay, so this is about odonto. Okay, this is about odonto. Can you see in this picture the first radiograph? Let's go to the first radiograph because this is an IBQ image based question. Okay, so we are discussing IBQs along with the videos. Okay, can you see this thing? See this structure there? There is some kind of radio opacities. So odontomes usually come with radio opacities surrounded by little radiolucency. Okay, odontomes usually come with radio opacity because they are hard tissue structures. They come with radio opacity and they have a small radiolucency surrounding it. Okay, and in this you can see, okay, I can appreciate a piece of enamel. Okay, I can appreciate enamel, some kind of pulpal tissue inside, and in between there is dentine, and it is looking like a teeth. Okay, it is looking like it is having a structural arrangement like a teeth. Okay, I will erase and you can see it again little more clearer. Okay, enamel, dentine and pulp. Okay, arrangement is there. I can see that it is looking like a teeth. So this is a compound odonto. Okay, it's a compound odonto. And if you come to this structure, can you see there is radio opacity? There is a big radio opacity there, a big radio opacity there, and you can see around that you have a radiolucency, right? There is a radio opacity in the center, and you can see these areas, you have a radiolucency surrounding it, and you don't see any any resemblance to a tooth there. It is just a mass. It's just a big mass, a conglomerate mass. So this is a complex odonto. Okay, complex odonto. Okay, so this is about odontoma, and I hope you remember the syndromes where you see odontomas, right? Do you remember? Okay, we have discussed the syndromes in the first videos. Okay, syndromes where you see odontomas. Okay, please try to recollect. You can remember at least one syndrome where you see multiple things, multiple odontomas. Your Gardner syndrome, right? Gardner syndrome, you can see so much of odontomas. I would like to say Herman was a gardener. Okay, her husband was a gardener. Okay, Herman was a gardener. Oh, Herman syndrome, Gardner syndrome. Okay, Herman was a gardener. Herman syndrome, Gardner syndromes are two syndromes where you see odontoma. So this is how we try to learn things. Okay, I hope odontomas is clear to you. See you in the next video with a new topic.